Jest ze mną dr Tamer, jeden z najlepszych chirurgów operacji Nosa w Istambule. Hello, dr Tamer.
Hi.
Hello. Zadamy 5 pytań, które od Was dostaliśmy. Mam nadzieję, że dostaniecie w pełni usatysfakcjonowaną odpowiedź od doktora Tamera. Dr Tamer, I have 5 questions to you from our patients.
Okay.
First, how long the treatment's operation last?
How long does it last?
Yes, how long? How many hours?
Generally, 2 hours and a half or 3.5 hours in primary cases.
Mm-hmm.
But in secondary cases, sometimes it lasts, let's say, 5 to 6 hours.
But the most of them are about 2-3 hours.
Yeah, 2 or 3
Okay,
hours.
great. Second, how long does the patients have to wear the bandage?
In first postoperative period, first week of the postoperative period, it will be okay. After that, on the 7th day, we can remove the cast and the bandages.
Okay, so after 7 days we can remove the bandage and everything
Yes.
is okay.
Yes.
Great. But there's some signs of the operation or?
Generally, in some cases, there will be a little bruising or edema may stay there. But let's say in 12 to 14 days after the operation, she can go a dinner, let's say.
Okay.
She can socialize.
So everything after 14 days, everything should be
Yeah.
like new.
Yeah.
Okay, great. Third question, how long does the recovery take?
It depends the patient's skin. In thin skin patients, sometimes 3 months will be enough, but in thick skin patients, sometimes it takes 9 months to 1 year, because swelling and edema will be stay more on thick skin patients.
Mm-hmm.
But first 3 months is very crucial. But as I said before, it depends the type of skin.
Okay. Fourth question, after how long does the nose fully return to its correct shape?
On the table, let's say. But when he or she awaked from the operation, there will be edema.
Mm-hmm.
And it is going to reduce on first 3 months. Generally, we can see the final result on third month of the postoperative period. But the final result can be seen at 6 to 9 months.
6 to 9 months, and the most people have this 6 months or 9 months. But how many people have the shorter one? Time to get full recovery?
20% of the public have thin skin, and they are going to get the final result on third months.
On third months, okay.
Yeah.
And the last question, what activities must not be performed after the procedure?
Physical activities will be restricted on first postoperative month, because while doing the external aesthetic operation, we are reducing the size of the turbinates of nose to make it a well-breathing nose also, not just a
not
well
only the look,
yeah.
but the good health.
It's an organ that has functional and aesthetic factors, and for that reason, since we reduce the size of the turbinates, there will be some crusts inside of your nose, inside of your nose, and they are going to release them, let's say, 4 to 6 weeks after the operation. After that, she can do any physical activities.
Okay, and
but at the first days of the operation, she can walk.
So first days after surgery, there is no some for example, she can meet with friends, she can go for dinner, she can walk, she can go for stairs, and
Yeah.
everything is okay for normal function.
Yeah, but hyperactive activities,
Like sports and
yeah,
everything
like
is
sports
not
or
good.
weightlifting or activities increasing intra-abdominal and intracranial pressure. It may lead to nasal bleeding. That's why in first month we need to restrict it.
So we need to rest on the first
Yeah.
month, but
Yeah.
we can do normal things in the
daily
normal
life.
day.
She can, yes.
Okay, and what you can tell to the people who are thinking about to change their look? What can you say? Because sometimes they're ashamed, they're afraid, but they want to do it. You know?
I say my patients never give up the operation that you want for anyone. That's why it's your life. If you want an operation, you can undergo the operation. Never give up for anyone, and never be operated for anyone also, because it's your decision. And if you want it very much, I'm sure that most of the patient will be satisfied with the results with an experienced surgeon.
Thank you very much. I jak widzicie, fajne podsumowanie na sam koniec. Nigdy nie róbcie operacji tak naprawdę dla kogoś, róbcie to przede wszystkim dla siebie. I myślę, że to jest fajne podsumowanie tego wywiadu z doktorem Tamerem. Thank you very much, Dr. Tamer.
You're welcome.
It's nice to meet you. Moi drodzy, tak jak powiedzieliśmy ostatnim razem, gdy nagrywaliśmy, jeśli chcecie coś zrobić, zróbcie to, bo to tak naprawdę robicie dla siebie. I tym akcentem zakończymy dzisiejszy wywiad.